All right, so I've got to figure out what I'm going to do about healthcare. I mentioned earlier that I left my job a little over a month ago. That means I'm eligible for COBRA for the first 90 days. I have not actually committed to that yet because the way that it works, if I need health coverage, so if something bad happens, I can actually be covered as if I had been paying my premiums for the past 3 months, but I don't have to pay those premiums unless I commit to the plan. So it gives me a little bit of cushion before I have to actually decide. And in a way, as long as I don't end up in the ER, it's like having 3 free months where I don't have to pay for health care. But the problem is I've been procrastinating making that decision and doing the research. If I do go with COBRA, it's going to be fairly expensive, so I need to look at some other options. The ACA Marketplace plan is also going to be pretty expensive for me this year because I do have enough income at this point that I get penalized pretty heavily for that one. So the third option I was thinking about was a crowdsourcing plan, which is not actually insurance. And so I'm really curious what you guys think, if anyone out there has used one of those companies, because that may be a way to lower my healthcare costs over the next year or two while I get my income levels down and under control so that I can afford the Marketplace plan much easier. Yeah, it's a little bit of a risk for sure, because you're counting on the community to come together if you have a medical emergency, and they do have a somewhat of a track record, but it's kind of a new thing that's being promoted out there. So yeah, I'm really curious if any of you have used it or are using it. Let me know in the comments. I'd love to hear what your experience has been so far. Other than that, I'm not really sure what other options I have. Not going to go without coverage. I did keep running into trees. So the month or two before I left my job, I went to the doctor. I had a full checkup, got a colonoscopy and full clean bill of health there. They said I'm good for the next 10 years. Did the dental work, all the things. And so, I'm feeling pretty good. I guess my only risk is I'm pretty active and I'm a fairly regular consumer of the emergency room. At least I have been in the past. I'm obviously trying to be a lot more careful now, but mountain biking injuries, I like to rock climb. There are just sports that I tend to get myself into a little bit of trouble. And so if I'm going to go with, this crowdsourcing option or whatever, I need to try to stay out of the emergency room, I guess. Maybe that's the goal, because because the way I see insurance, it's more for that crisis, that major emergency. If I have to pay out of pocket for regular visits for a physical or whatever, that's fine. I want to make sure I'm covered if some, catastrophic thing comes up that I couldn't cover myself. So anyway, please let me know in the comments below. What do you think? Any other ideas? And also, if you haven't already liked and subscribed, please do. By the way, check out the view. Urban Salt Lake City hiking. If you haven't been to Utah, I would highly recommend it.